Every day is another story. In Mazi Okoro's house, every day is another story in Ghana's parliament. There's a parliament, you know, they be omukwasem fufuresi, they be omukwasem fufuresi, and in some media, hey, chichirekete na go. In some media say HSSA bebre, and mama ya we so muka LGBTQ huasem parliament di hu abobo we si we na ye na e wesenka we sign it we HSA NDC for ne so mo ntwe e ma MPP form nkonua mesoa mo na na e wesem mo pass bill ni into law e na mo anya na abedru ye so ade na mba yesa to mo gu so mo na mo na afi ye bepie health minister eso eye honorable Kwabna Akando ai Kwabna Menta Akando ne ho ne yebesiye na your friend say health minister bra bejina parliament yenim na afei be chirechirem eniyema ekoso health sector ne yen sheda ntia say we know the bad my nigga enti bra ne ba be chirechirem e chire ye nyina enti health minister so by obejina podium no so just omo to be manono afenyo market say kasa honorable Jerry kasa hey na say na mini NDC papa isa. This is AFENYO Strengths, and here we give you the latest updates on issues. Internet the health minister so na yedru no I'll be yin sembia no mako ama yeni na yatibi matiasie. My name is Maureen Marshall, and I'll be your waitress for the day. I'm serving you all the gist and all the tea from Ghana's Parliament House. Don't forget to like, comment, and subscribe. Subscription no here. No one say leave your comment. What do you think about what we are about to discuss? And before I see a health minister so no, and chief of staff, honorable Julius Deborah, and so kojina baby can once them say, national health insurance no. What can I say? NDC for the campaign last year 2024 omo manifesto omo campaign bebre say omo betil yewo NHIS levy bi a omo de banner den say no omo kromo chire mankofo bi ntiase entiene honorable Julius Deborah at NHIS National Health Insurance Scheme no watre ni levy ne plan nase and also so kase sa NHIS ade ebetimi a generate 3.4 billion cedis for Ghana. I obetimi a generate 3.4 billion Ghana cedis every month. Ye dey be take care of IRA for free no. Uko say uko hospital yes we lab ya fa. Uko we ya yes we lab ya fa. Uko we ya yes we yes wundro no pray free no. Umse sa levy no Ghana ebenya 3.4 billion Ghana cedis. I 3.4 billion enkanititi scano the number of friend 100 million and next guy a friend 100,000 Ghana cedis no just say yenyama akuma ko saa just say yenya say 10 and yenyama akuma ko 30 na 4 esanso guachire nti nyes kaketwa e na honorable Julius Deborah e ka ho asem.
As you are aware, our 2024 NDC manifesto articulated a bold and people-centered vision for the health sector. Among others, we pledged to uncap the National Health Insurance Levy, also establish the Ghana Medical Trust Care, popularly known as Mahama Care, and also implement the free primary health care, FPHC, and expand infrastructure and delivery service. 10 months into our administration, I am pleased to report that we have already uncapped the National Health Insurance Levy, which will make available an extra 3.4 billion cedis into the fund this year. This will go a long way to support claim payment, operations, and administrative functions. We are beginning to see the impact. Rapid claim payment. As of today, the total amount of funds disbursed by NHIA for this year 2025 to healthcare providers is 2.8 billion cedis. This timely injection of funds is increasing provider confidence, encouraging compliance, and driving enrollment growth.
Now fe yefi Honorable Julius Deborah ni yako Honorable Jerry Ahmed. Honorable Jerry Ahmed say yeah minority no amo etoda mu biema no na micro minority no. Or say you guys should be careful. You guys should be very very careful because although they say omo ya mighty minority na mighty minority no they are going to fight and fight to the core for Ghanaians. I almost Ghana for ye be kunto kwama mo ade bia NDC aban ne ye na enye bia ne yen ye ne de yen se boy bono ye se ye be kwama mo ye be kwa ye bibia ye cause as o meje o man no mo pese o mo say no Honorable Jerry Ahmed na eka o ono na eka.
Mr. Speaker, as we speak today, the NHIS for close to about 2 months is not working. It's not. NHIS. People would have to pay before they are provided services. As we speak, the LIMS is also not working. It's deactivated. And so we virtually reverted to the cash and carry system. Yes, it's not politics. When we are here to check. So if you want to do politics as usual, it's not going to help. And then the final one, Mr. Speaker, still for pregnant women, as we speak, any woman who is pregnant and wants to go through the CS, the cesarean surgery, would have to pay between 5,000 to 9,000. So we need to bring this to the notice of the leader of government business so that all of this will be resolved.
Enti ye free Honorable Jerry Ahmed honoma ne asa atiesi eye health minister ho. So me catch am say ene parliament ene ye free Honorable AKANDO. Yes, Honorable Kwabnaminta AKANDO. Your friend or parliament say ombeyi ne ho ano ewo health sector nsensem bi hu no ba no say all public hospitals will be rolled out onto a new medical record system in the next 4 weeks. Into the next 4 weeks, all public hospitals say owned by the government, ye be rolling onto a new medical system in the next 4 weeks. And na me no ka say in October. Into next 4 weeks, meaning the next as November, assembly year can or see ye be rolling na private for one can wo wanga sana wa shori anopa and what you know say Missy Hospital no wesi ya won kan.
Mr. Speaker, so honorable members, the good news is that I've said with you the challenges we have inherited where the medical records, the electronic medical records was being hosted by an individual where the country didn't have access to our service. But at the moment, Mr. Speaker, we have the solution and we are rolling out in the whole country. We have a 4 weeks plan. In the first 1 week, next week, we are rolling more than 100 facilities. The third week, more than 100 facilities. And Mr. Speaker, I can assure you, with the shortest possible time, we'll get all these 450 facilities covered. Mr. Speaker, what this vendor was doing to the state was that as and when he demands what, then you switch the thing off. And Mr. Speaker, for your information, the server doesn't even sit in Ghana. It's far away in India. Yes, far away in India. Mr. Speaker, we are religiously guided by this contract and we'll put in place the necessary solutions so that we'll prevent the reoccurrence of the mess we have inherited. Mr. Speaker, tomorrow, as I've already indicated, we'll give a full presentation on these issues, pictorial evidences, and we'll also tell the people of this country what we are going to roll out. I thank you for the opportunity.
Na se me catch am say health minister kasa papa ene so my friend abegina podium no so when you know one ye beka so a very incompetent and he's not doing his work well in the net na assembly so wasanso aka health minister say the shutdown of the national electronic medical record system will not in any case hinder data collection intino or can say shut down be because so baby and then go for bisa ne say electronic medical record system no we say be hardware we see a collected data me who say oh on these dates nipa way by hospital on these days or maintained by hospital into we say e be hinda hinda na say because we have a lot of questions and then obviously we need yentiase and a health minister say adwobreo the shutdown is not in any way going to hinder data collection. So now about 25th May and also about 29th May and hinder no cry. Nini na bewa system yes, electronic medical records no. Or sini na bewa system nimu. Amobiye who say ani obai intino. I don't know mo can say shutdown no be affect no. Enye no kre ensikra ebi nsikra.
I want to ask a question as a follow-up to the answer given by the Honorable Minister. The Minister stated that the data that is captured is very relevant to the health sector. But currently, I'm privy to information that the National Electronic Medical Record System is down. So if the National Electronic Medical System that captures all records of medical issues is down, how are you capturing the data? How are you able to store the data and even access and use that data for the benefit of Ghanaians?
Well, Honorable Minister. Yes, Honorable Minister.
Thank you, Mr. Speaker. Mr. Speaker, it is true that we have some challenges with regards to our patients' electronic records. Mr. Speaker, I can assure you that tomorrow I'm going to address the whole country to tell the whole country what we have inherited, what we are going through, and most importantly, the solution. And so I can assure you that it's not going to block or hinder the collection of data at all in any case. It will not.
Na yes afa health minister Honorable Kwabena Menta Akando ebegina podium no so no wa wonim say mighty minority leader Honorable AFENYO Markins there want me mane nkosa without asking him questions obebisa ne bibi na AFENYO Markins bisa ne say are there plans to provide antiretroviral drugs to infected patients at no cost intino AFENYO Markins bisa say antiretroviral drugs no ye de bema patients ni free ana are there plans omo ye hu hye ana wona aye health minister inti ye bisa wo hye bi wo hono ma ana ye bisa wo NHS AFENYO de ene boldness no kan intino me tumira no machirisi I don't want the situation whereby to say ye can smash honorable am bisa no matiase aye.
That one he has assured us that very soon. What I want to know from my respected colleague is that are there plans to put infected people also on the antiretroviral drugs for free? Because by the time the symptoms show, the person would have gotten to the advanced stage. Mr. Speaker, I have done an exercise in Winneba because when the data came out, it was so alarming, and a lot of those who were infected were saved by Safo Kantanka's drugs.
Na nya no nkwanso na Honorable Kayo. Honorable Saka Chire House and they say, are they aware that there are people who don't, as they contact, yen start on for. So Honorable AFENYO Markins, as also bisa, health minister say, people don't get HIV only through sexual intercourse. Or catch it say HIV in some near cost nature make catch say one co school and win say HIV and yes sexual intercourse and kwanya dinner HIV I make catch on e bo crab blade me channel e bo crot me kofo bi toothbrush into HIV there your kwan bebre ayedinya AFENYO Honorable AFENYO me checking it to minority leader and
the deterioration is faster than the most feared HIV/AIDS. All over, people are suffering, and it's not only through sex that people get infected. Even sweat alone, the food. Yes, food, drink is there. Body contact alone can cause the infection. So, Mr. Speaker, can the minister make that disclosure if there is any such plan?
It is answering na ekoso no. Health Minister esanso ka asem bi. Nasema can say he is resetting the health sector for the ultimate safety of all of us. He's resetting the health sector. Into no person or catcher you say, "Adie bia oba ye it just ye de health sector ne share nsa oba ya na nyina." He's resetting or some he's resetting nature say abeye safe for all of us into ade na oye ne say oye for no nko. He's just oye adwuma or boy adwuma for all of us. He knows say nurses asema betwam ko obia dia betwam kakra ko ba asem na okanyina ne say he's resetting the health sector for the safety of all of us.
Mr. Speaker, so honorable members, the good news is that I've said with you the challenges we have inherited, where the medical records, the electronic medical records was being hosted by an individual, where the country didn't have access to our service. But at the moment, Mr. Speaker, we have the solution, and we are rolling out in the whole country. We have a 4-week plan. In the first 1 week, next week, we are rolling more than 100 facilities. The third week, more than 100 facilities. And Mr. Speaker, I can assure you, with the shortest possible time, we'll get all these 450 facilities covered. Mr. Speaker, what this vendor was doing to the state was that as and when he demands what, then you switch the thing off. And Mr. Speaker, for your information, the server doesn't even sit in Ghana. It's far away in India. Yes, far away in India. Mr. Speaker, we are religiously guided by this contract, and we'll put in place the necessary solutions so that we'll prevent the reoccurrence of the mess we have inherited. Mr. Speaker, tomorrow, as I've already indicated, we'll give a full presentation on these issues, pictorial evidences, and we'll also tell the people of this country what we are going to roll out. I thank you for the opportunity.
Yama Health Minister yiyi insembiano in some na doso Honorable Julius Debranso the NHIS living some no swaba be cham. This is FMS Trends, and here we give you the latest updates on issues. I hope you enjoyed this video. Don't forget to like, comment, and subscribe. Subscription no here, or comments no here. What do you think about Ghana's health sector? Ekoye mama. And I say Nkoye. All the videos that we played, we don't own rights to them. No copyright infringement intended. Thank you.